Painkillers are among the most commonly used medication for those who undergo physical therapy rehabilitation. Some people think that since it can be purchased over the counter, they just simply rely on it and have it for long-term use. But how safe can it be? In this video, you will know more about the different over-the-counter painkillers, when or when not to use them to help you determine if it's safe for you or not. Greetings again to everyone. This is again Doc Cherry, Doctor of Physical Therapy. If you're new here in my channel, please don't forget to click the subscribe and the bell button below so you will be a part of our growing community and you will receive weekly health videos on a weekend that will benefit our beloved seniors, you and your family. Aspirin and other pain relievers will reduce the substance that is responsible for pain, inflammation, and fever in your body. Although these pain relievers would give the same effects, you need to understand that not all painkillers are the same. Usage should be personalized and is best recommended by your physician. Here are the common over-the-counter painkillers and the safety concerns associated with it. Number 1, aspirin. It is the oldest and most commonly used pain reliever that can help you if you have mild to moderate pain. It is at times used even after extensive surgery to decrease the need for high doses of opioids. Pain relief from aspirin can be compared to opioids but without the side effects of sleepiness and difficulty with breathing. So if you experience pain and there is redness or swelling on the affected body part, aspirin can help you. Aspirin can be used for both osteo and rheumatoid arthritis and can also be used to treat fever in adults. It is not safe to use aspirin to help treat fever in children because it had been linked to Reye syndrome. Reye syndrome is a rare condition that can cause brain and liver damage. Although Reye syndrome can happen in all ages, it is said to be more common in children. It is also not safe for you to use aspirin if you have hemophilia, conditions where there are clotting problems such as dengue fever, if you presently have kidney and liver problem, and if you are lactating or if you are pregnant. Number 2, ibuprofen. It's a type of painkiller that would be gentler to your stomach as compared to aspirin. It is effective for the relief of minor to moderate aches and pains due to rheumatoid and osteoarthritis, backache, muscular aches, and even toothaches in adults. It can also be used to relieve fever, but because of its shorter duration of action, you may be required to take it 3 or 4 times a day. It is not safe to use ibuprofen if you currently have heart problem. Dosage of greater than 1,200 mg of ibuprofen daily will give you side effects. It is not advised for people with existing kidney and liver problem, if you are diabetic, and for those who have history of seizure, because ibuprofen can trigger a seizure attack. It is also not safe for you to use ibuprofen if you are currently taking blood thinners because it can have adverse drug interaction. Number 3, paracetamol or acetaminophen. It has the same effects as aspirin and ibuprofen in relieving pain and fever, but it won't help in conditions where there is swelling and redness. It also does not have any anticoagulant effect. But one advantage of paracetamol is it would be good for those who have ulcers since it will not give you any gastric irritation. It should be the first pain reliever to use to control pain in the early stages of osteoarthritis and other musculoskeletal conditions which do not present with swelling and redness. Unlike aspirin, paracetamol is not linked to Reye syndrome. That's why it can be used for fever in children and teenagers. Because paracetamol will not give you any gastric irritation, it can give false impressions to users that it has no side effects at all. On the contrary, 15 grams of paracetamol can be very toxic to the liver, so use it with precaution. Number 4, mefenamic acid. It can be used for less than 7 days to treat mild to moderate pain in adults and children who are at least 14 years old. It can be used for pain and inflammation and can be used to treat menstrual cramps. Mefenamic acid can be less effective but more toxic than aspirin and ibuprofen. People with existing cardiovascular problems should not use mefenamic acid long-term because it will predispose one to developing heart attack and stroke. High dosage and long-term use of mefenamic acid can also lead to gastric and intestinal bleeding, especially for those who are younger than 14 years old. Number 5, Naproxen sodium. It is similar to ibuprofen in terms of benefits for pain and inflammation, and it has the same noted side effects. It can be used to treat pain or inflammation like gout, osteo and rheumatoid arthritis, tendinitis, and bursitis. The use of Naproxen sodium, especially in children, should not be done, especially without medical advice. Naproxen sodium, just like mefenamic acid, can predispose one to having stroke and fatal heart attack for those people who already have existing heart problems. Naproxen sodium is also not safe for pregnant women, especially if you are on your last 20 weeks of pregnancy, because it can cause serious side effects to the brain and the kidney of your baby. Number 6, diclofenac sodium. It is more potent than naproxen and other pain relievers in relieving pain and inflammation. It is useful for mild to moderate pain caused by rheumatoid arthritis, menstrual pain, and to treat migraine that has already begun, but it cannot prevent headaches or reduce the number of attacks. Long-term use and high dosage of diclofenac sodium is not safe because it will cause gastric and stomach bleeding, especially in older adults. These are the common over-the-counter painkillers and the safety precautions associated with it. It is still best to ask your physician before you use them, especially if you already have existing medical conditions. Please share this important information to your friends and family members so you are able to help them as well. Since this medical advice is for free, please don't forget to click the like button if you find this video helpful. Should you have any questions regarding over-the-counter painkillers or any topics that I might be able to help you with, please feel free to comment down below because I would really get back on you. This is again Doc Sherry. Stay safe, stay healthy, God bless you.